Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. Depression, this common yet complex condition, affects many lives, and it's crucial to shed light on the strategies and support available for those in need. So, let's embark on this journey to uncover the intricacies of depression, its treatments, and the hope for a brighter tomorrow. Depression is a prevalent condition which can significantly impact daily life and lead to distressing symptoms. The mainstay treatments for depression encompass psychological therapies and the use of antidepressant medications. While treatment requires time to take effect, it carries a promising chance of success. Some individuals experience recurring episodes of depression, necessitating ongoing treatment to manage and alleviate symptoms. What is depression? The term depressed is commonly used in everyday language, often to express feelings of being unhappy due to life events, such as relationship issues, bereavement, redundancy, or illness. These events are part of life and have a negative impact on our mood. However, this usually lasts for a short period and then our mood goes back to normal. As they say, time is the best healer. Clinical depression, however, is a mood disorder characterized by persistent low mood and other daily symptoms that endure for over at least 2 weeks. In some cases, these symptoms become severe enough to disrupt regular activities. How common is depression? Depression is a common condition, yet many individuals hesitate to acknowledge it. Some may associate stigma or perceive it as a sign of weakness. Nevertheless, depression ranks among the most frequently encountered illnesses handled by family doctors. Approximately 5 out of every 100 adults experience depression each year. In some cases, it may be mild and short-lived. However, about 1 in 4 women and 1 in 10 men will face a severe episode of depression requiring treatment at some point in their lives. Some individuals may experience 2 or more episodes of depression at different times in their lives. Symptoms of depression. While many individuals can identify when they are experiencing depression, some may not recognize it. They might feel that something is amiss and that they are not functioning optimally but may not comprehend the underlying cause. Physical symptoms, such as weight loss, can sometimes be wrongly attributed to a physical illness when they are, in fact, linked to depression. Depression is associated with a specific set of symptoms that aid in diagnosis. There are 9 common signs and symptoms of depression. These include the following. Core symptoms. 1. Persistent sadness or low mood, with or without a tendency to cry. 2. Profound loss of interest or pleasure in activities that you would typically enjoy. Other symptoms associated with depression. 3. Disturbed sleep patterns compared to your usual routine, which can manifest as difficulty falling asleep, early waking with an inability to return to sleep, or excessive sleeping. 4. Changes in appetite, often leading to a poor appetite and weight loss, but sometimes resulting in comfort eating and weight gain. 5. Fatigue and a sense of low energy. 6. Agitation or slowed movements. 7. Impaired concentration or indecisiveness, making tasks like reading and working challenging. 8. Feelings of worthlessness or excessive and inappropriate guilt. 9. Recurrent thoughts of death, including preoccupation with death and dying. Some individuals may experience thoughts like life's not worth living or I don't care if I don't wake up, and in severe cases, these thoughts may progress to thoughts about, and even plans for, suicide. Many individuals with depression report that their symptoms are often most severe in the morning. Additionally, depression can lead to physical symptoms such as headaches, palpitations, a sensation of a thumping heart, chest pains, and general aches. In some cases, people consult a doctor due to physical symptoms, like chest pains, fearing a heart condition when it is actually related to depression. It's worth noting that depression is a common cause of physical symptoms. Conversely, individuals with significant physical ailments are more likely to develop depression. In severe cases, some individuals with depression may experience delusions and/or hallucinations, referred to as psychotic symptoms. Delusions are false beliefs that others within the same culture would consider incorrect, such as the belief that people are conspiring to harm you. Hallucinations involve perceiving things that are not real through the senses, like hearing voices or seeing things that others cannot. Depression diagnosis and severity. People diagnosed with depression usually experience symptoms of depression for most days, most of the time, for at least 2 weeks. Depression severity can vary significantly from one person to another and is generally categorized as follows. 1. Severe depression. Typically involves most or all of the 9 symptoms mentioned earlier. Symptoms significantly disrupt normal functioning. 2. Moderate depression. Usually encompasses more than the 5 symptoms required for a depression diagnosis. Typically includes both core symptoms. Severity of symptoms and impairment falls between mild and severe. 3. Mild depression. Typically involves having 5 of the required symptoms for a depression diagnosis. Generally, no more than 5 or 6 of the symptoms are present. Normal functioning is only mildly affected. 4. Subthreshold depression. Involves having fewer than the 5 symptoms necessary for a depression diagnosis and is not categorized as depression. The symptoms experienced are troublesome and distressing. When this condition persists for over 2 years, it is sometimes referred to as dysthymia. Causes of depression. The precise cause of depression remains unknown. It can affect anyone, and while some individuals may be more susceptible, depression can also develop seemingly without a clear trigger. Symptoms of depression may surface even when there are no apparent problems or worries. Therefore, it's possible that genetic factors play a role in making some people more prone to depression. In this context, genetic implies that the condition can be passed down through families. Moreover, an episode of depression can be prompted by life events, such as relationship issues, bereavement, redundancy, or illness. For many people, it's a combination of both factors. For instance, experiencing a mild low mood along with life stressors like work-related tension can lead to a descent into depression. Women are more likely to experience depression than men, with common times for women to develop depression being after childbirth, postnatal depression, and during the menopausal transition. Depression and physical conditions. While the precise cause of depression remains unclear, there are some important considerations regarding its relationship with physical conditions. 1. Depression and physical conditions. Depression is more prevalent in individuals known to have specific physical conditions. While treating the physical ailment is a priority, addressing depression can also enhance overall well-being. 2. Undiagnosed physical conditions. Various physical conditions can initially appear to mimic depression. Physicians are vigilant for these conditions and may order tests to rule them out when suspected. Some common examples include underactive thyroid gland. Hypothyroidism can lead to low mood, tearfulness, and fatigue, but can be diagnosed with a blood test. Underactive pituitary gland. Hypopituitarism. This gland, located just under the brain, produces various hormones. A deficiency in one or more hormones can result in symptoms like low mood, depression, and even suicidal thoughts. Blood tests help diagnose this condition, which may be caused by factors such as head injury. Head injury, even a mild head injury, even in the distant past, has been associated with higher rates of suicide, presumably linked to depression. One potential explanation for this connection is that head injuries may lead to hypopituitarism, as mentioned earlier. Polymyalgia rheumatica, mainly affecting older individuals. This condition presents symptoms like stiffness, pain, depression, and muscle tenderness, particularly in the shoulder and upper arm areas. Depression can be an initial prominent symptom before other manifestations become predominant. Early dementia. Early dementia is sometimes mistaken for depression. Certain medications, both prescribed and illicit drugs, can have side effects that mimic depression. These considerations emphasize the importance of a comprehensive assessment when evaluating symptoms of depression, including the potential influence of physical conditions and medication use. Opting for no treatment. Many people with depression eventually improve without treatment, but this process may take several months or longer, with the average duration of a depressive episode being 6 to 8 months. However, living with depression can be challenging and distressing, potentially affecting relationships, employment, and leading to risky behaviors like substance misuse or even suicidal thoughts. As a result, many individuals with depression choose to seek treatment. Treating depression, the following are common treatment options for individuals with depression. Personal preferences play a significant role in deciding the most suitable treatment in consultation with a healthcare provider. 1. Guided self-help. This approach involves structured cognitive behavioral therapy, CBT, and behavioral activation, BA. These focus on the interaction between thoughts, beliefs, attitudes, feelings, and behavior, teaching coping skills for managing life differently and engage in mood-improving behaviors. 2. Group exercise has been shown to improve depressive and anxiety symptoms. 3. Mindfulness and meditation helps to concentrate on being present, observing thoughts, feelings, bodily sensations, and breathing exercises. Counseling focuses on emotional processing and finding emotional meaning, aiding individuals in developing coping strategies and discovering their own solutions. 6. Couple therapy for depression. Couple therapy, or couples counseling, may be a suitable choice for individuals who have a consistent partner and believe that their relationship plays a role in their depression. In such cases, involving the partner in therapy is seen as potentially beneficial for addressing and managing depression. This collaborative approach aims to enhance the relationship dynamics, communication, and overall well-being of both partners, which can contribute to alleviating depressive symptoms and fostering a healthier, more supportive environment. Antidepressant medication are commonly used alongside talking therapies. Selective serotonin reuptake inhibitors, SSRIs, are the most commonly prescribed antidepressants, usually taken for at least 6 months, even after symptoms improve. These medications can alleviate symptoms such as low mood, poor sleep, and poor concentration, enabling individuals to function better and cope with problems and difficult circumstances. Other ways of dealing with depression. Dealing with depression can be challenging, but there are several strategies that may help. Share your feelings, don't keep your emotions bottled up. Talk to people close to you about how you're feeling. It's not a sign of weakness to express your struggles. Sharing your emotions can provide much-needed support. Open up to loved ones. While you might be inclined to keep your symptoms to yourself, being open with close friends and family can help them better understand your situation and offer support. Maintain hope. Remind yourself that most people with depression do recover. Keeping this in mind can be a source of hope during difficult times. Distract yourself. Engage in activities that offer distraction without requiring intense concentration. Watching TV, listening to the radio, or participating in hobbies can help divert your thoughts, especially if sleep is a challenge. Eat regularly. Even if you don't have much of an appetite, try to maintain a healthy diet. Proper nutrition plays a role in overall well-being. Limit alcohol. Although alcohol might seem like a quick fix for depression symptoms, excessive drinking can worsen your condition in the long term. It's challenging to assess and treat depression when alcohol use is a factor. Delay major decisions. Refrain from making significant life decisions, such as quitting a job or relocating, while in the midst of depression. Try to delay such choices until you are feeling better. Seek help if worsening. If your condition deteriorates, especially if you are experiencing suicidal thoughts, inform your doctor promptly. Consider time off work. In some cases, taking time off work may be necessary. However, extended periods off work can lead to increased rumination and worsen symptoms. Returning to a regular routine as you begin to improve may aid in the healing process. Every individual's situation is unique. Address psychological causes. Some psychological issues, such as past traumatic experiences like childhood sexual abuse, can lead to depression. Don't hesitate to discuss any potential underlying causes with your doctor. Counseling may be available to help address these issues. Understanding that your symptoms are a result of depression can be reassuring. Knowing that you are not going mad and that many others have experienced similar symptoms can provide comfort. Related conditions. Postnatal depression. Some women develop depression shortly after giving birth. This is known as postnatal depression. Bipolar disorder. This is a mental health condition where you have periods of extreme depression followed by periods of mania where you feel very high and overactive. Seasonal affective disorder. Some people experience depression triggered by specific times of the year or seasons, such as during the winter or around the holidays. This is known as seasonal affective disorder, SAD. Co-occurring mental health issues. Depression can sometimes coincide with other mental health problems. Conditions like anxiety disorders, panic disorder, and personality disorders are commonly associated with depression. Typically, depression is treated first, followed by addressing the other disorder. Treating depression may also lead to improvements in co-occurring anxiety. Eating disorders, such as anorexia and bulimia, may be present alongside depression, with the eating disorder often becoming the primary focus of treatment. Discussing your individual situation with a healthcare professional can provide valuable guidance. Conclusion: understanding the complexities of depression and its treatment options empowers individuals to seek help, manage their symptoms, and work towards recovery. Depression is a challenge that many face, but it's important to remember that most people can and do recover. With the right support, be it through therapy, medication, or lifestyle changes, there is hope for a brighter future. Remember, you're not alone in this journey, and seeking help is a sign of strength. And that's it, guys. We have covered a lot of useful information today. I hope that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.